Hi everyone, my name is Kira,
And my name is Cassidy.
and we are both student nurses with Cedar Crest College who recently traveled to Panama. This is our presentation on the healthcare in Panama and just a little bit about our experiences there.
First, our objectives for the PowerPoint is we would like to identify the differences in healthcare between the United States and Panama on a national level, and then identify the differences in healthcare and resources between Allentown and Panama on a city level. And lastly, we'd like to discuss our in-country experience.
So, just a little bit about the structure of healthcare both between Panama and the United States. Panama is made up of three different components to their healthcare system. They have the MINSA, or the Ministry of Health, Social Security, and a private healthcare system. Social Security is both health insurance and a pension fund. In 2019, about 3.5 million of the 3.9 million of the population were covered by Social Security. It comes out of the person's paycheck, and they take about 20 to 25% of the paycheck, so that is a pretty large chunk of that. And the MINSA, or the Ministry of Health, they provide low-cost facilities for those who are not covered. So even if you don't have health insurance, you can still go get health care for a low cost. In the United States, we consist of both a public and private healthcare systems. Public is made up of the Medicare, the Medicaid, and the military fund. This covers about 45% of our population. And the private is typically provided through your employer or is available through purchase and covers about 55% of our population. Problems with Panama's health system. So there are a few large problems. Is one, the lack of funding. There's not enough funding from the government, so this creates a big bed shortage for patients. There's either just not the actual beds for them to be in to get health care, or there's just not enough personnel to cover those beds, creating the shortage. And then there's an increase in fees for those who don't have coverage. So like we said, we had the low cost for people who don't have any type of insurance. These fees for them are going to be more because of the lack of funding to try to compensate for what isn't being given to them. And then in addition, there's the location of doctors. So doctors prefer to stay in Panama City for three main reasons. There is a higher patient load, so there's more patients for them to take care of. There's more economic opportunities, so they can advance more in their careers for themselves, and then also medical tourism, so aesthetic and orthopedic, and that's a big thing in Central and South American countries, is a lot of plastic surgery. And then Panama in specific has a very large influx of people for dentistry procedures. This is just a little map of Panama to give you an idea of where we were. So by number 1 on the map is Panama City. That is where we flew into. And then the next day we traveled all the way to Panama, which is in number 3, which is the province of Coclé. And then from Panama, each day we traveled out to a small village called Pajona.
So what we did as a student of nursing in Panama is we gave a free healthcare clinic in Pajona Central Village, which is a city in the mountainous region. We provided full head-to-toe assessments, we gave vision exams, and we would hand out glasses, and we also would provide medications from our pharmacy under the administration orders of a Dr. Priscilla, who traveled with us from Panama City. While we were in Panama, we had 3 full days that we went to Pajona Village. The first day, we did community visits to hand out the tickets with the time and date that the patient should come for the clinic, and we would also do home assessments. And as you can see in that one picture of community visits, our path was a little treacherous to get to all of our patients, but we wanted to make sure that we got to as many people as we could in that community. After that, we had 2 days of clinic. As in that picture, you can see that is where we had lunch and where the children would play while we were giving care to their families or while they were waiting in line. We also then, the next day, went to the Panama local health clinic. We were lucky enough to have a tour from a few of the nurses and Dr. Irving, who ran that facility. And from that tour, as well as our own personal research, we then discovered the differences in local healthcare in Panama and Allentown. Panama has about 3,000 people, and for that 3,000 people, they have 2 public care centers. Within those centers, they each have dentistry, mental health, pediatrics, OBGYN services, general health, all in that one center, and each clinic will see about 650 patients a day. To take care of all of these patients, they have 20 licensed staff members, which includes nurses and doctors, with unlicensed personnel to assist them. In Panama, there is 1 hospital, and for that 1 hospital, they have 5 ambulances. 3 of those ambulances, however, are only used for transport from the Panama hospital to hospitals in Panama City, which means in that large region, they only have about 2 ambulances in circulation to respond to emergencies. This is different than Allentown, where we have a much larger population of about 120,000, and we have over 100 healthcare centers. And we have more of a fractured healthcare system, where we have separate dentistry, mental health, OBGYN, and family medicine centers. And included in that, we also have urgent care centers, which is what that public care center acts as in Panama. Also in Allentown, we have 7 main hospitals, mostly our LVH and St. Luke's branches, and we also have 8 ambulances from the Allentown Ambulance Corporation, which are all used to respond to emergencies, and the Citrone ambulances also patrol Allentown, which increases the amount of ambulances we have in circulation.
So pictured here are just a few images from the local health clinic in Panama that we visited. The first picture is the dentistry area, so a dental examination area. The second picture indicates that they have mental health care there. And then the third picture is just an image of a very basic patient examination room within the clinic. Each doctor has their own office and examination room within the clinic. Some are more decorated than others. It just kind of all depended on the preference, but this is just the basic of the rooms there.
Lastly, we also discussed the most prevalent health issues with Dr. Irving and the other nurses while we were at the Panama Health Clinic. They said that they mostly saw patients for cold and flu reasons if they were coming in for acute care, and also exacerbations of chronic diseases. In that area, it was mostly renal disease, cancer, diabetes, and gallbladder diseases. But they also had quite a high population of patients getting treatment for parasitic diseases, and they also reported a lot of interpersonal violence within the area of Panama. This differs from the most prevalent health issues in Allentown. From the Institute for Health Metrics and Evaluation, the most prevalent health issue that we have in our community is cancer, followed closely by chronic diseases of hypertension, COPD, and Alzheimer's. Next, we also have a much higher use of drug use disorders and stroke compared to Panama. Access to healthcare in Panama is also different than Allentown. So, for example, patients in Pajonal Central Village, where we gave care, they have to drive at least 40 minutes to the closest healthcare facility. Additionally, all of the patients in Panama can only purchase drugs that are over the counter in America with a prescription. So our doctor that we traveled with would write prescriptions for acetaminophen and ibuprofen for our patients with chronic pains. Also, clinics will not turn away someone without health insurance. As Kira mentioned earlier, they will just have a higher pay to give to that facility, and they also will set up a payment plan if they cannot pay for everything at that time.
In addition, just real quick about the transportation, how it takes at least 40 minutes to get to a healthcare facility. This is also pending that somebody has a way to transport via car. A lot of these people walk from their homes into the town because they do not have other means of transportation. And lastly, these are just some more photos from our trip. The first photo there on the left is us showing off our Year of the Nurse signs, and then the second picture is us at the clinic with 3 of the nurses, and then all the way on the left there, that's Dr. Irving, who was our host while we were there.
Lastly, we just want to say thank you for listening to our presentation, and hopefully next year we will no longer have to have presentations like this and we'll be meeting again for Capstone Day.